First, we're going to start with our head, hair, and scalp, inspecting and assessing for bumps, bruises, lacerations, or any other abnormality. Then let's inspect and assess our ears, making sure all skin is intact, that there's no drainage coming out of the ears, and behind the ears there's no bumps, bruises, or lacerations. Then let's go on and assess our nose. Looking, making sure the nares are equal, symmetrical. Looking up the nares, making sure there's nothing in there, no drainage or anything blocking the airway.
Can you take your finger and block one of your nostrils? Take a deep breath. Now the other. Thank you.
Now let's inspect and assess the eyes for direct and consensual response and accommodation, which equals PERLA. PERLA is pupils are equal, round, reactive to light, and accommodation. Taking your pen light, going in and watching the pupils
Look right there for me.
Accommodation, have the patient look at the object as you move it slowly towards the nose. Both eyes should move towards the object, inward. Let's now inspect and assess our lips. They should be pink and moist. There should be no open sores or cuts present. Then have your patient open their mouth.
Can you open your mouth for me?
The mouth should be pink and moist. Also assessing teeth, looking for dental caries, loose teeth, or any bleeding around the gums. Have the patient smile.
Can you smile for me?
The smile should be symmetrical with both sides of the lips going upward at the same time. Then let's have the client stick their tongue out, checking for moisture, making sure it's pink, having them turn it side to side, and then looking up underneath with your pen light. You should note a very vascular area. There should be no bumps or tumors or cuts present. Then let's go ahead and inspect and assess the neck. Have the patient turn their head side to side.
Can you turn that way for me? Any pain when you do that?
No.
You turn this way? Any pain there?
No.
And up and down.
Up and down. Did that hurt at all?
No.
Okay.
Then let's go ahead and assess our carotid pulses bilaterally. Only assess one at a time.
Thank you.
Look at the neck veins on your patient, and if needed, you can lie the patient flat, have them sit up 15 degrees and then 45 degrees looking for jugular vein distension. None should be noted. Next, we're going to assess the lymph system, looking for swelling and discomfort of the neck. Palpating on each side, the lymph system goes from the top, right below the chin, down the neck. Now we would like to listen to breath sounds. You'll have the patient turn their head away and breathe in and out through their mouth. So first we're going to inspect the chest, looking for rise and fall, symmetry and shape. Also inspecting respiratory pattern. Now we're going to auscultate breath sounds, taking your stethoscope, and you want to find the clavicle on the right side. coming down just below and placing your stethoscope, listening to the breath sounds. Have the patient turn their head to the side, opening their mouth with a slow in and out. Number 1. Then you're going to slide across the sternum all the way to the same spot on the other side is number 2. Drop the diaphragm of your stethoscope above the nipple line is number 3. And the same spot directly across is number 4. Dropping down under the nipple line is number 5. And coming directly across is number 6. Same spot, opposite side. Then drop down just slightly and out is number 7. That is the anterior breath sounds. Now have your patient sit up. Let's start listening to the posterior breath sounds. Starting at the top, between the scapula and the other side of the spinal column will be number 1, having the patient breathe in and out through their mouth. 1, moving directly across, same spot, other side of the spinal column. 2, dropping down. 3, directly across, same spot. 4, dropping down. 5, directly across, same spot. 6, down from there, going to the lower lobes. 7, and directly across, same spot. 8, and then there drop down, lower the bottom of the rib cage to get 9, listening to the very base of the lungs, and then opposite for 10. Having your patient lay back down, and we're going to start to inspect the abdomen. We're then going to auscultate for bowel sounds in all 4 quadrants. Always remembering to auscultate before palpating the abdomen. Then we want to palpate the abdomen with a light touch with your 4 finger pads in all 4 quadrants.
Any pain?
No.
Any pain?
No.
Any pain?
No.
Any pain?
No.
Then we want to sit the patient back up, and we're going to assess the upper and lower extremities. First, we'll check the radial pulse on both sides, and then the brachial pulses.
It's radials on both sides, now the brachial.
Then we want to check the temperature of the skin. And then movement of extremities.
Put your arms up, and then out, and then back to center. Drop them.
We're going to then inspect and assess for edema. Checking strength bilaterally.
Grab my fingers, squeeze hard. Okay. Can you put your hands up and they'll push against me? Very good. And I want you to pull back towards you. Very good.
And then skin turgor. Now lower extremities. We're going to check the femoral, popliteal, posterior tibia, and pedal pulses bilaterally.
Femorals, strong both sides. Popliteals, strong both sides. Posterior tibialis, strong and equal on both sides. Dorsalis pedis, strong and equal on both sides.
Then we'll check the temperature. Movement of extremities times 2.
Can you lift your right leg up? There you go. Drop it. Left leg. Can you bend your knee? Same side. Good.
Now we would check for gait if the patient were walking in or out of the room. But if the patient is in bed, you can actually assess that afterwards. But always looking in the room, surveying the area for a walker, cane, or wheelchair. Then we want to look and assess for edema of the lower extremities. And no edema should be present.
No edema is present.
And then strength.
Can you pull your feet up towards you? There you go. And now I want you to push down as hard as you can. Very good. Strong
And that strong, awesome. And now the perineal and perirectal assessment will be done at another time. Thank you.